Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. Last lecture, you must have find that I have winded up little early because I was so much in hurry. So I just mentioned about the Kamla and its type. Let us discuss them in detail hereafter. In last lecture, I told you the two types. All you know, Bhubitta Kamla and Uddapata Kamla. The main question is in Bhupitta Kamala, we can diagnose easily clinically because of yellow color stools and all over mucus of the body is yellow, yellow eyes, yellow skin, yellow, dark yellow urine. And in Uddapata Kamala, the clay color stool is observed because bile cannot come in the intestines because of Ruddapatha or Aurojanya Samprapti, which is we call it as a obstructive jaundice also. My question was how we will diagnose this avrodh in the bile duct is inside bile, for example because of bile stones or gallbladder stones, like mainly which is a commonly uh, common cause of this Ruddapatha, or whether bile duct is obstructed from the outside, like some tumor of the head of the pancreas, like pathology. So this avrodh is inside the bile duct tract or outside. How will you diagnose was my question, and my answer will be, for this exact obstructive pathology you need to have get the use of the investigations, the facilities which we have in our hand today, whether it is sonography, CT scan, whatever you prefer. See, I have seen many doctors in Ayurveda which believe in Ayurveda, nothing wrong in that, they have faith in Ayurveda, but they are very reluctant for these modern investigations. Now tell me whether X-ray is Ayurvedic or allopathic. It is neither Ayurvedic nor allopathic. It is the physics that some rays are passed to the object and they produce image after passing through any object. Now, this is the physics which has been used for the medical diagnosis. Now, if I have X-ray of a patient and a report of the X-ray saying congestion of the curve in the chest, I'm just giving the example. Now I can diagnose this patient, or I can interpret this report in my language of Ayurveda, where I will say it is a Kaphajakas or there is Kapha Sanchiti. It depends on me. So using X-ray, using modern technology investigations, many people find that this is anti-Ayurveda or you should not prefer for this modern techniques. I have seen many Vaidyas doing this thing. That's why I am taking some time on this point. But if this sonography or X-ray or even any investigations is or are implementation of physics or biochemistry, and the allopathic medicine have interpreted that in their language, we can also interpret these investigations in our language. For example, if hemoglobin is low, the diagnosis as anemia, you can do it as Pandu, like that. Just can give examples. So, if USG reports showing ascites, you can diagnose it as a udar, as a lakshan or a disease. It depends on you and your history of the patient. So in my opinion, it is really, at least for my sake of point of view, that I can't diagnose clinically. We can diagnose clinically as it is a clay color stool, it is Ruddapatha, but I myself can't diagnose it that whether it is Ruddapatha from inside the bile duct or outside, from outside pressure of some tumor or any other thing. So I will make the use of the sonography CT scan, whatever I need, and then I will interpret that diagnosis in my Ayurvedic language. Hence, I have seen the people that they even have Uttapata Kamala, they don't go for sonography, and just because of obstructive they give some medicines, and then after some time it is seen that the obstruction was out of bile duct of the tumor, etc., and much more time has been wasted in just treating Uddhavata Kamala in mentioned in the text. So it will be it is my point of view I am keeping in front of you that using modern techniques is nothing anti-Ayurvedic in that. First thing. Secondly, we are at least it is my opinion. I am not able to have that third vision or sixth sense, what you say, that I can you just use Nadi Pariksha and I can get diagnosed that it is Avrod is at which place. At least I am not capable of. So it is my duty to cure the patient, and to cure the patient I want exact position inside the body, and if I am not able to do it on my way clinically, then I must make the use of the modern techniques which are available in our hands. So it will be my request to all of you, in such case of the Pitta or any other disease, if you are really want Sukshma Samiksha and exact condition inside the body, don't hesitate to perform the proper investigations, and you interpret the investigations in your Ayurvedic language. Just as take the example to the example of the Kamala. Similarly, in the Kamala Vyadhi, all the liver tests like uh, hemogram or mainly liver function tests are very much useful. First, to diagnose the Rudrapathak or Bhupitta Kamala. Secondly, for the prognosis of the patient after you have given the treatment. See, if there is Bhupitta Kamala and bilirubin is raised, it is about say 7 or 8, and I have given the medicines Ayurvedic in my after creating Samprapti in Ayurvedic language. After giving medicine, if I perform the report again of LFT and the bilirubin which has been raised is seen to be lower down, then I can understand what the treatment is going on the right way. On the contrary, if it has been increased, I can again think that I have to change some medicines. I am giving Ayurvedic medicines only, but these reports help us for diagnosis as well as prognosis without compromising principles of Ayurveda, whether it is of Nidan, Samprati, Chikitsa, whatever it is. Hence, friends, I am requesting all of you by giving examples of Uttapata Kamala that don't hesitate to go for the proper investigations. I have seen the Vaidyas that they don't prescribe investigations or suggest investigations, but if patient has reports with them, they also ignore those reports also. So why we are giving such loopholes in our Nidan and Chikitsa when we have some good methods, techniques in our hands in modern era? Hence, to do proper investigations, or if patient has investigations already with him, don't hesitate to go through them in detail, interpret them in your language of Ayurveda, and give the treatment which will give the patient relief and success to you also. We will discuss. I have given this lecture for this point to have some stress in on this point, because it is very important in today's era. It is important as a practitioner also, and it is important medico legally also, because if something happens, a court may ask you that have you done the investigations required for this disease. So Please don't hesitate to do proper investigations and go through them in detail, interpret them in your Ayurvedic paribhasha, and give the patient relief, and it will add to your success also. Thank you very much. We will meet in the next lecture with the remaining part of the Kamala. Thank you very much.